No alcohol, no junk food. But your doctor says you have fatty liver? If you're over 60, the culprit may not be your diet, it could be hiding in your medicine cabinet. Fatty liver disease, also known as NAFLD, non-alcoholic fatty liver disease, affects up to 40% of older adults after age 60, and the risk increases with age, even if you don't drink alcohol. But here's the good news. Many cases are reversible if caught early. Hi, I'm from Golden Aging Health. In today's video, we'll explore 5 common medications that can silently worsen liver damage after age 60 and safer alternatives to discuss with your doctor. As always, don't forget to like the video and subscribe to Golden Aging Health for more trusted tips for seniors like you. Be sure to watch until the end, because 2 out of the 5 medicines you're about to see are probably right in your home right now. Important note before we begin. Medications can affect people differently, especially as we age. The information in this video is not medical advice. Always speak with your doctor before stopping, starting, or switching any medications. Medication number 1. Statins. Let's start with one of the most prescribed drugs in the world, statins. These are cholesterol-lowering medications like atorvastatin, Lipitor, simvastatin, Zocor, and rosuvastatin, Crestor. Millions of seniors take them daily to prevent heart disease. But here's what most people don't realize. Statins can sometimes worsen fatty liver disease, especially in those who already have NAFLD after 60. According to the National Institute on Aging, statins are processed directly by the liver. In rare cases, they can cause elevations in liver enzymes, a sign of liver inflammation or stress. While many people tolerate statins well, older adults with existing fatty liver damage after 60 may be more vulnerable to side effects. Harvard Health explains that in patients with non-alcoholic fatty liver disease, statins can sometimes have a double-edged effect. For some, they may actually improve liver enzymes over time. But for others, especially when taken in high doses or combined with other medications, they may silently increase the risk of liver scarring or progression toward cirrhosis. So, what should you watch for? If you're on a statin and experience unusual fatigue, upper right abdominal pain, or dark-colored urine, these could be warning signs of liver distress. It's essential to tell your doctor and get liver function tests, especially if you're taking more than one medication that affects the liver. The advice you need right now: never take a statin without consulting your doctor. But if you've been diagnosed with fatty liver disease, ask about alternative cholesterol treatments like ezetimibe, or diet-based strategies like the Mediterranean diet, which has been shown to reduce liver fat in older adults. Are you currently taking a statin, or have you experienced side effects from this medication? Leave a comment below. Your story may help someone else dealing with a similar problem. Medication number 2, Methotrexate. The second drug on our list is Methotrexate, a medication often prescribed for rheumatoid arthritis, psoriasis, and certain cancers. While it's highly effective, especially for chronic inflammation, Methotrexate has a well-known downside: liver toxicity, particularly in seniors. According to the Mayo Clinic, Methotrexate interferes with folate metabolism, which is essential for healthy liver cell repair. Over time, especially with long-term use, this can lead to fatty infiltration of the liver, fibrosis, and even irreversible scarring known as cirrhosis. And here's what's important: the risk isn't just from high doses. Studies published in the Journal of the American Geriatric Society, JAGS, found that even low-dose methotrexate, when taken weekly over several years, can contribute to silent liver damage, especially if the patient is over 60, has diabetes, or is overweight. Mr. Harold, a 72-year-old retiree, had been taking low-dose methotrexate for over 3 years to control his rheumatoid arthritis. He never drank alcohol and ate fairly well. But during a routine checkup, his blood work showed elevated liver enzymes. An ultrasound later confirmed fatty liver disease. His doctor immediately adjusted his medications and added folic acid supplements. Within 6 months, his liver function started improving, all because it was caught in time. Mild signs like persistent fatigue, low appetite, or feeling uncomfortably full after small meals can be early hints of liver strain. More serious symptoms like abdominal swelling, mental confusion, or yellowed skin need immediate attention. If methotrexate is part of your treatment plan, don't discontinue it on your own. Instead, have an honest discussion with your doctor. Request liver enzyme tests regularly and ask whether folate supplementation is right for you. Coming up, a popular drug that prevents breast cancer from recurring may actually be silently damaging your liver. Especially if you're an older woman. What is it, and are you at risk without knowing it? Find out in Part 4. Medication number 3, Amiodarone. Now let's talk about a heart drug that has saved many lives but also caused quiet concern among liver specialists. Amiodarone, commonly used to treat irregular heartbeats, especially atrial fibrillation, the drug is a mainstay of geriatric care. But for adults over 60, it poses a hidden danger: long-term liver toxicity that often builds up silently. One case in particular has sparked discussion in the medical community. A 74-year-old retired aerospace engineer, we'll call him Frank, had been stable on amiodarone for a year. Then he suddenly developed fatigue, bloating, and pain under his ribs. His liver enzymes were twice normal. Imaging revealed fatty liver, a known complication associated with amiodarone. Doctors quickly tapered him off the drug and switched him to an alternative heart rhythm drug. His condition improved, but it raises an important question: how many other older adults may be at risk without knowing it? According to the American Heart Association, amiodarone is stored in body fat, including fat around the liver, where it can linger and build up. Over time, this buildup can cause inflammation of liver tissue, leading to fatty liver disease or even liver failure without any warning signs. The risks of this drug are unique because the damage can happen slowly, often without the patient feeling anything until the disease is advanced. Older adults with impaired liver function, a condition that naturally declines with age, are even more vulnerable. The best defense: ask your doctor to check your liver regularly, ideally every 6 months. Ask for an ultrasound early and review your medication list together. In some cases, switching to a milder alternative like dronedarone or relying more on rhythm control therapy may be a safer plan in the long run. What about you? Has anyone in your family ever taken amiodarone? I'd love to hear from you. Medication number 4, Tamoxifen. It may sound surprising, but one of the go-to drugs for preventing breast cancer recurrence has been linked to an unexpected side effect: fatty liver, especially in older women. So, what's going on here? That drug is tamoxifen. It's often prescribed to help prevent estrogen receptor-positive breast cancer from recurring, and many women take it for 5 to 10 years. But what's rarely mentioned is that tamoxifen is strongly linked to the development of fatty liver disease, especially in postmenopausal women. According to research published in the International Journal of Gastroenterology, up to 43% of women taking long-term tamoxifen therapy develop some form of non-alcoholic fatty liver disease, NAFLD, often without any symptoms. Here's why this matters. Tamoxifen changes the way the body processes fat and insulin, and that change can lead to an abnormal buildup of fat in liver cells. And because most women who take the drug don't drink alcohol and focus on staying healthy, the condition often goes undetected until damage has already occurred. Barbara, a 68-year-old retired teacher, is an example. After completing chemotherapy, her doctor prescribed tamoxifen as part of her cancer care. After 2 years, routine tests showed elevated liver enzymes. She had no pain, no digestive problems, just a little fatigue. Imaging confirmed early-stage fatty liver. Thanks to early detection, she was able to switch to lifestyle-based liver support, cutting back on sugar and increasing gentle exercise, preventing further damage. If you're currently taking tamoxifen, don't panic. The drug has huge benefits. But you should absolutely ask your doctor about liver-friendly adjustments, including a Mediterranean-style diet, vitamin E, or switching to an aromatase inhibitor if appropriate. Medication number 5. Acetaminophen and OTC painkillers. Finally, we come to a drug that is likely in the medicine cabinet of most seniors, acetaminophen, commonly known by its brand name, Tylenol. It is used to treat headaches, arthritis, fever, and joint pain. When used properly, it is considered safe. But it is a potential danger, especially after age 60. As we grow older, our liver's detox ability declines, even without any diagnosed disease. According to Harvard Health Publishing, what's considered a normal dose for younger adults can become risky in older age. This risk climbs further when acetaminophen is used daily or taken alongside alcohol or other medications that compete for the liver's processing power. The real issue? It's hidden in plain sight. Acetaminophen is combined in countless products from pain relievers to cold and flu meds, to sleep aids and even opioids like hydrocodone acetaminophen, Norco. A senior managing multiple symptoms can unknowingly go over the recommended daily limit of 3,000 milligrams without ever realizing it. Warning signs include a sudden loss of appetite, persistent nausea, yellowing of the skin, or mental fog. These may seem minor at first but can escalate quickly. To stay safe, review every label. Look for acetaminophen or APAP, and don't exceed 3,000 milligrams per day or 2,000 milligrams if you already have fatty liver or a history of alcohol use. Your pharmacist can help you identify overlapping products. Have you ever accidentally taken too much acetaminophen or combined pain relievers without realizing it? Share your story. It could be a real eye-opener for others watching. We've covered a lot today, and if you're over 60, these insights could be life-changing. Here's a quick rundown of 5 medications that can increase your risk of fatty liver disease, and how many of them you have. Statins can worsen liver issues if you already have fatty liver. Methotrexate, long-term use may cause hidden liver scarring. Tamoxifen, linked to fatty liver, especially in older women. Amiodarone builds up in fat and may slowly damage the liver. Acetaminophen, easy to overdose on when combined with other meds. Each of these medications has value. None of them are inherently bad. The real danger lies in ignorance and lack of monitoring, especially in older adults, whose liver function may already be declining. So what can you do today? Review your medication list with your doctor or pharmacist. Ask, do any of these medications put me at risk for liver stress? Should we check my liver enzymes? Are there safer alternatives? If you're managing fatty liver disease, ask about taking liver-friendly supplements like vitamin E or incorporating a Mediterranean diet. Studies in the Journal of Hepatology show that it can reduce liver fat in older adults by up to 30% within a year. Keep a personal diary of any medications that contain acetaminophen, and don't be afraid to ask, can this be taken with another medication I'm taking? Your liver works silently every day to keep you healthy. Give back by staying informed, asking better questions, and choosing the right medications carefully. If this video has been helpful, please like, subscribe, and hit the bell icon so you never miss a senior health update like yours. I hope you live each day to the fullest. Don't stop here. Want a clean liver, healthy lungs, and healthier kidneys every day? Check out the liver, lung, and kidney health playlist on our channel. I believe you won't want to miss out on what's good for your health.